So the Buffalo group decided that, importantly, that we need something in addition to the treadmill test that will be a valid measure of exercise tolerance. And so recently they've been doing some work with an exercise bike. Now, Dr. Letty has an exercise bike that's about 20 grand. And I don't think any of us have access to toys like that. And so the protocol I'm going to present to you today is a modified protocol from that particular bike to the types of bikes that you see in here today. And so really their questions were, can they use a bike that will be comparable to the treadmill test? And could it also be useful to determine exercise tolerance? And maybe something that's feasible with a little broader range of patients. Patients have any contraindications to exercising on a treadmill, but they could exercise on an exercise bike. Can we use an exercise bike to get us the appropriate exercise prescription and assess exercise intolerance? So I'm not going to go through all this, but this was the algorithm that they used to determine how to correlate the bike stress test with the treadmill test. Because if you think about it with the treadmill test, the incline is the work. On a bike, we don't have incline, we have resistance. So what they needed to do was modify going from an incline on the treadmill to resistance on the bike. And they did a study on this and found some really helpful information. So when they took patients and had them do the treadmill test and then they repeated that test on the bike, what they found is that there really wasn't any difference in heart rate change over time between the two instruments. So that means we've got a pretty good measure as far as that goes. Now what they did find is that the bike is harder. So patients reported increased rate of perceived exertion on the bike test compared to the treadmill test. So that is something to keep in mind as a clinician if you administer this test.